So, hello everyone. So, this is the third day here in this wonderful event, the Gulf Intervention Society meeting for the year 2025. And today we will have a very exciting topic about AI. So, as we know, everybody is talking AI these days, and I do have the gentlemen on my right side are pioneers in cardiac imaging. I would like first to introduce Dr. Ahmed Bafadl. He's a consultant echocardiography cardiac imaging in Cleveland Clinic, Abu Dhabi. Welcome, Dr. Ahmed.
Thank you, Dr.
And
Tariq.
also Dr. Ahmed Saelik. He's a well-known senior consultant in cardiac imaging from National Guard Hospital in Riyadh, Saudi Arabia. My name is Tariq Al-Hussein. I'm a cardiologist also, and I'm an echocardiographer. And it's really wonderful to have both of you in this wonderful event. So tell us first, how do you find the GIS so far?
Actually, it's a very good meeting to learn from our peers on an interventional side. We are from the imaging side, so it's always good to get the other side perspective so we can understand when we work together. So I think it's a really good meeting.
Dr. Ahmed.
Yeah, it has been very fruitful, really journey, combining all the information from non-invasive imaging to invasive. It improved our understanding, and we hope that our work is improving also our patient care.
So the presence always of cardiac imagers and echocardiographer would always be the flavor of any interventional meeting, and this has been the trend actually more nowadays. So let's start by something general. So why do you think AI is crucial in cardiac imaging?
So if you look at in any center these days around the, let's say GCC, Middle East, globe, everywhere, you will see the volume has increased in imaging. The complexity has also merged. So you will need more tools to help the readers to expand their time, to expand their knowledge in terms of finding and experience how they can go deeply in images, okay? So AI can help in different perspective in imaging. We can come to that further, but I think the AI, is it a tool, can help our field to evolve faster.
Oh, that's wonderful. So Dr. Ahmed, so now, I'm talking now, not in the future. So how do you find AI useful nowadays in cardiac MRI?
Yeah, so two areas I would spot them. One area is as my daily work. I want to improve my efficiency, my diagnostic accuracy. And the other area is that I want to provide more accurate information, assessment for the others, like interventional cardiologists, so they can trust my finding. It can be very helpful for them to decide about their procedure and what is the best way to do it.
Okay, that's great. So let's take echo, for example. So now the AI is playing a role in echo, starting from the auto measurements until we end up about full reporting. So you get all the images, plot it in the AI machine, and the AI will generate a report. So how would you find this reliable, and do you trust the outputs?
So if we go back on time and look at our colleagues in radiology, for example, so I can see utilizing AI in screening the normal studies. That will help you boost faster reading, especially if you work in a high volume center. So they use that in chest X-ray. If you look at some center, they started use AI in a chest X-ray, especially outpatient X-ray, which has a normal, or at least a chunk of normal studies. So I think AI at one point will boost our reading for normal echoes. Okay, so if we look at every center, at least they have range from 30 to 70% of normal echoes, especially outpatient. So those ones is a good target for AI to help with.
Okay, and do you trust the output? Now we've came to across many AI tools that are now becoming more readily available. And they are talking about accuracy rate of 80%, some are talking about 90% in their auto-generated report. So do you see this will have a place
Yeah. So fortunately, we experienced the first steps of generating algorithm for AI. So in a way, we understood a little bit of the strength and limitations. And still at this stage, we cannot say that we trust it fully to replace, for example, the human factor, but we can really trust it for making it much faster, more efficient, and also that there are certain areas that we cannot do it by ourselves, like in the image processing, helping to improve the image quality and remove, for example, the noise from the CT or motion artifacts from images of CT. So yes, we trust it because we can see that there is a great improvement in the algorithm that we have that has been initially developed, and with more and more training, there is a better outcome that we can trust.
Okay. So I can tell you something. The word validation. So anything comes into medicine needs validation. Okay. So AI, when it comes, let's say an echo, it will need time, years, at least a couple of years or 3 years, to people to reread exactly. I can put an example actually. I put AI as you have an excellent fellow. When you have an excellent fellow, he can find good findings, but at the end you cannot sign the report unless you read the images. So you can treat your AI as an excellent fellow that he helps you, but then you review everything with him or her before you sign the report.
So you think that the human factor still plays the role about the validation and the final output?
Absolutely.
So you think we are able to secure our jobs for the coming 5 years?
We have to work more harder on ourselves. I think AI is a very strong, let's say, tool. It might replace some of our work, but not fully. But again, ourselves, we have to improve our understanding of how AI is working, because if we don't understand it, we might not trust it again, and maybe it might replace some of our job that it's important for us.
Okay, that's great.
So I have a comment about replacing, okay?
Yeah.
So I think it will help reducing the manpowers. If you have 5 readers, you will have 4, because the normal studies, the time in acquisition will be shorter. So you will have 20% less technician because they will scan faster. You will have less readers because it will give you the prelim faster. I think it will help reducing the manpower, not replacing.
Okay, that's wonderful. So let's talk about, and we look at the bigger picture. You get used to multiple screens whenever you are sitting and making your reports, and you always flip back and trying to look at the CT and then the MRI of the same patient and then have a look on the echo. So you try to, let me say, combining or do like a mental kind of a fusion in order to reach a diagnosis. So do you think AI will play a role, or is it currently already playing a role in combining all images together? So for example, if you have one patient who has done already a cardiac CT, an MRI, and an echo, and you have all the data, so could this be married by somehow and give you an output about reaching a precise diagnosis?
Yeah, I think this is a very important point. Especially that we are trying to utilize AI to reduce the number of tests the patient will have, like utilizing a test to the maximum that we can have the downstream imaging reduced. But say that the patient needs multiple imaging. Unfortunately, until now, there is little that we can fuse images, or we can utilize data from multiple images and combine them together. But the picture is a bit different when we are trying to say, for example, can we combine the imaging picture with cath lab or EP lab, for example, to guide their intervention? The picture is more promising, actually.
If you look at for example, at North America, now they have what is called multimodality consult. So they need someone with expertise in multiple images modalities to combine all the knowledge to give them an answer, especially in difficult cases. Okay, so I think this is a huge area that AI can help us with. For example, there's always question about viability. So viability is one of the cornerstone in cardiology. It makes you do things you don't want to do sometimes, make you don't do things that you should do. So at the end, there's a lot of areas in cardiology can understanding different modality because you will find a lot of centers, they have radiologists, who are excellent radiologists, tell them about the radiology finding. Cardiology tell them about the clinical scenario. But who comes in between is the multimodality imagers that understand all the picture. For example, amyloidosis, sarcoidosis, cases that were the storage diseases that nobody sometimes think about those rare diseases. So AI will come and look at all the screens and come tells you there is a 65% chance this patient might have amyloidosis, for example. So those suggestions will say, I can see and look for this. I think this is a good tool to use.
Yeah, and now I came across one study that they trained an algorithm that look back and screen multi-echoes, and in those who are confirmed with having and end up with an amyloid, for example. So it developed like an algorithm for early detection. So at least it'll give you like an alarm.
Yes.
Because a lot of patients, they have thickened myocardium that they get past in the reporting as mild LVH, borderline LVH on every day, and those are having subtle cardiac amyloidosis. So this detection. So do you think like if you have the luxury to have such an AI tool, would it how
I might comment on this. There's something called alert fatigue, where if you apply, for example, alert in a system about something like, let's say that you found that the LV thickness is high, like a bit thick wall, and then you alert the end users or the readers that this might be amyloid. They call it false positive, a lot of false positives. So this causes a lot of alerts that's false, and this might cause the fatigue and less responsive to this alert from the end users. So unless it becomes more like really precise and specific, it might be probably a negative effect actually.
Okay, that's great. Okay, so as a final word, so if you could make a choice, okay, and I ask you to choose one AI innovation that you would think of that could transform the cardiac imaging in the next 10 years, what would be your choice?
So I do CT, I do MRI. I think the development of the AI in a CT was much faster in the CT arena than the MRI, especially the acquisition time of the cardiac MRI and the technical difficulties for the breathing and the motion of the heart, synchronization with the ECG. This makes a bit the acquisition time long. And we have been trying to reduce the time by omitting some sequences, adding some sequences, modifying. There are some tools, but still the acquisition time is really long. I think if I want something that can change really the picture of cardiac MRI is to reduce the acquisition time. That would add a lot of patients, more patients can be done, and the waiting time can be reduced.
Ahmed?
So, as Dr. Ahmed was saying, one heartbeat acquisition, if we can, so decrease the time of MRI, which is actually making a lot of patients unhappy, the MRI. But I think the future will be increasing the volume of reading, okay, by the normals, reading the normals, helping assisting AI-assisted image acquisition in terms of acquiring the image in an echo. CT scan, I think if the FFR CT company use an AI and add it as a tool to the machines and providers, so this can give you an actual AI FFR on-site analysis instead of sending to the company. One more thing with regarding the MRI. So for the MRI also, the segmentation, which takes time. The technical part from a lot of technician, this can be in the future. I think some center, if the manufacturer of MRI machine can use the AI, this will standardize the good quality. I mean, instead of you see bad images, MRI from some center, I think using AI tool that will give you a better segmentation, better acquisition from the technical side.
Okay, so just we will be closing with a final advice, I would call it, to the junior doctors. So what would be your advice?
When I start reading about AI and machine learning, I completely get lost. So I think we are acquiring AI and healthcare very late and very slow. And my advice for the junior is to start from day one learning imaging and learning AI in imaging. You spend the same time learning, how to acquire image, interpret image, but also learn what is the application of AI in cardiac imaging. I think it's extremely important. It is not something minor.
For the junior, I think they should know but not depend on the AI. So especially junior, I mean for fellows. Junior consultant, they already passed the training, but I think I would not advise fellows and trainees to, especially if the tools available, to depend on them. For example, lung nodules. Lung nodules now, radiology, they have tools to find or suggest lung nodule. I noticed that training with radiology that they apply that tool and they don't look for it. Then when they go to a center where they don't have AI, they struggle to find lung nodules. So at the end, they should have the perfect, good training. At the same time, a module or a month in AI to train the AI and understand the difference between human and AI, but not to use it during the training to reporting.
Thank you, Dr. Bafadl. It's really wonderful to have you today. And Dr. Saili, it's really a pleasure to have you. Thanks for your time, for your effort. And we will close our session for today. And I hope you enjoy your stay here in Dubai and enjoy the rest of the meeting. Thank you very much and goodbye.
Thank you very much. Thank you.